Hey everyone, welcome back to the channel. Today we're diving into something that affects millions of people around the world, what still gets underestimated, misunderstood, and sometimes even ignored. That's right, we're talking about anxiety disorders. In this video, we're going to break it down from A to Z. What exactly is anxiety? The different types you need to know, signs and symptoms to watch out for, risk factors, when to get help, how doctors diagnose it, complications if left untreated, treatment options, and some life-changing tips to help you cope or even prevent anxiety from taking over your life. So if you or someone you love is struggling with anxiety, this video is for you. Let's get started. First things, let's define what anxiety actually is. Anxiety is a natural response our body has to stress or danger. It's that fight or flight feeling you get before a big test, a job interview, or even when you almost miss your train. But when that feeling doesn't go away, when it's constant, overwhelming, and starts affecting your daily life, that's when it becomes an anxiety disorder. It's not just being stressed. It's not just worrying. It's a real diagnosable mental health condition that deserves attention and care. Now let's talk about the signs and symptoms. Anxiety affects both your mind and body, so the symptoms can be emotional, psychological, and physical. Here are the most common ones. Mental and emotional symptoms are constant worry or fear, feeling restless or on edge, trouble concentrating, irritability, fear of losing control or dying, catastrophizing everything. Physical symptoms are rapid heartbeat, sweating, trembling or shaking, shortness of breath, chest pain or tightness, stomach issues, headaches, fatigue, trouble sleeping. And the worst part? These symptoms can come out of nowhere, even when there's no real danger. But there is something very important, which is not all anxiety is the same. There are different types, and each one has its own triggers and symptoms. Let's go over the main types. 1. Generalized anxiety disorder. Constant, excessive worry about everyday things, even when there's no reason to worry. It includes persistent and excessive anxiety and worry about activities or events. Even ordinary routine issues. The worry is out of proportion to the actual circumstance, is difficult to control, and affects how you feel physically. It often occurs along with other anxiety disorders or depression. 2. Panic disorder. Sudden, intense panic attacks with physical symptoms like chest pain, shortness of breath, and fear of dying. It also involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, called panic attacks. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart. These panic attacks may lead to worrying about them happening again, or avoiding situations in which they've occurred. 3. Social anxiety disorder. Extreme fear of social situations, being judged or embarrassed in public. It involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Specific phobias, irrational fear of specific things or situations like flying, spiders, or needles. Agoraphobia, fear of places or situations where escape might be difficult, like crowds, public transport, or open spaces that might cause you to panic and make you feel trapped, helpless, or embarrassed. 60. Separation anxiety disorder, usually in kids but can happen in adults too. Intense fear of being separated from loved ones and related to separation from parents or others who have parental roles. Selective mutism, usually in children, is a consistent failure of children to speak in certain situations, such as school, even when they can speak in other situations, such as at home with close family members. This can interfere with school, work, and social functioning. Substance-induced anxiety. characterized by symptoms of intense anxiety or panic that are a direct result of misusing drugs, taking medications, being exposed to a toxic substance, or withdrawal from drugs. And there's also anxiety due to medical conditions, like hyperthyroidism or heart disease. So if you've ever thought, is this just stress or something more? This list might help you understand what you're going through. So if you've ever thought, is this just stress or something more? This list might help you understand what you're going through. Now let's talk about why some people are more likely to develop anxiety disorders than others. Now, let's talk about why some people are more likely to develop anxiety disorders than others. Here are the top risk factors. 1. Genetics. If someone in your family had anxiety, you might be more prone to it. 2. Brain chemistry. Imbalances in neurotransmitters like serotonin and dopamine can play a role. 3. Trauma. Children who endured abuse or trauma or witnessed traumatic events are at higher risk of developing an anxiety disorder at some point in life. Adults who experience a traumatic event also can develop anxiety disorders. 4. Stressful life events. Big life changes, loss, job stress, relationship problems all can trigger anxiety. 5. Personality. People with low self-esteem, perfectionism, or a tendency to avoid problems may be more vulnerable. 6. Medical conditions. Chronic illness, pain, or hormonal issues can contribute. 7. Substance use. Alcohol, drugs, or even caffeine can worsen anxiety. 8. Gender. Women are more likely to be diagnosed with anxiety disorders, possibly due to hormonal changes and social pressures. So while anyone can get anxiety, some people are more at risk than others. Now, when you really want to see a doctor, if your anxiety is interfering with your daily life, work, school, relationships, sleep, it's time to see a doctor. Here are the red flags. 1. Constant worry that won't go away. 2. Physical symptoms that have no medical cause. 3. Panic attacks that come out of nowhere. 4. Avoiding people, places, or situations. 5. Trouble sleeping or eating. 6. Feeling like you can't control your anxiety anymore. If any of these sound familiar, don't wait. Anxiety is treatable. You don't have to suffer in silence. Now, how do doctors actually diagnose anxiety? First, they'll do a physical exam to rule out any medical causes. Then, they'll ask about your symptoms, family history, and lifestyle. They might also do lab tests, like checking your thyroid or blood sugar. If everything checks out, you'll likely be referred to a mental health professional, like a psychologist or psychiatrist. They'll use tools like the DSM-5, which is the Mental Health Diagnosis Manual, and maybe questionnaires to assess the severity. The key is to be honest and open. The more you share, the better they can help. Now, what happens if anxiety is left untreated? Left untreated, anxiety doesn't just stay in your head, it can ruin your life. Here's what can happen. Depression. Anxiety often leads to depression, and vice versa. When one condition is present, it can exacerbate the other, creating a challenging cycle to break. 2. Substance abuse. Some people turn to alcohol or drugs to cope with their anxiety, seeking temporary relief from their distressing feelings. 3. Relationship problems. Constant worry or panic associated with anxiety can strain relationships with family, friends, and colleagues. 4. Work-school performance. Anxiety can make it hard to focus, show up, or perform effectively in work or academic settings, leading to poor performance. 5. Physical health issues. Chronic anxiety can cause heart problems, digestive issues, and chronic pain, affecting overall physical health. 6. Suicidal thoughts. In severe cases, anxiety can lead to suicidal ideation. This is why early diagnosis and treatment are so important. To prevent anxiety from severely impacting one's life. The good news, anxiety is highly treatable. Here are the most effective treatments. Therapy. Techniques like cognitive behavioral therapy, which is the gold standard, and exposure therapy for phobias are highly effective. 2. Medication. Treatments include selective serotonin reuptake inhibitors, benzodiazepines for short-term use, and beta blockers for physical symptoms. 3. Lifestyle changes. You should try exercise, diet, sleep, breathing techniques, and meditation to manage anxiety effectively. 4. Support groups. Talking to others who understand can be incredibly healing and provide essential support. 5. Apps and tools. There are great apps like Headspace, Calm, or Wobot to help manage anxiety daily. So whether it's therapy, meds, or both, help is out there. Now we're going to talk about how to prevent having anxiety. Even if you're already dealing with anxiety, there are things you can do to reduce it or prevent future episodes. Here are my top 10 tips. 1. Exercise regularly. Even a 20-minute walk can help. 2. Eat a balanced diet. Avoid too much caffeine or sugar. 3. Get enough sleep. Aim for 7 to 8 hours. 4. Practice mindfulness or meditation daily. 5. Limit stress. Say no when you need to. 6. Talk to someone. Don't suffer alone. 7. Limit screen time, especially social media. 8. Journal your thoughts. It helps release stress. 9. Breathe deeply. Try box breathing or 4-7-8. 10. Set small goals and celebrate every win. These habits might seem small, but they can make a huge difference over time. All right, that was a deep dive into anxiety disorders, but I hope it helped you understand what anxiety really is, how it affects your life, and what you can do about it. If this video resonated with you, or if you know someone who needs to hear this, please share it. Don't forget to like, subscribe, and hit that bell so you never miss another mental health video. And if you want more tips on coping with anxiety, comment below. I'll make more videos on this topic. Until next time, take care of yourself, and remember, you are not alone.